A brief overview of cerebral palsy. Definitions and types. Cerebral refers to the cerebrum, area of brain affected in cerebral palsy, and palsy refers to the disorder of the movements. Cerebral palsy is damage to the motor control centers of the developing brain that leads to limitations in movement and posture that cause activity limitations. It can be accompanied by disturbances of sensation, depth perception, and other sight-based perceptual problems. There are different types of cerebral palsy, with the most common form being spastic cerebral palsy. This includes sudden involuntary movements, muscle stiffening, which makes movement difficult. Another type is atherosclerotic cerebral palsy. It includes uncontrolled slow body movements that affects entire body. Ataxic cerebral palsy is irregular muscle coordination and lack of balance. Hypotonic cerebral palsy is diminished muscle tone, so the patient is ragdoll-like. Also, there is mixed cerebral palsy, which shows signs of more than one type. The etiology of cerebral palsy can be due to various things. There is unidentifiable causes. Typical causes of cerebral palsy include in the intrauterine development, such as exposure of radiation and infection. Other causes can be asphyxia before birth, hypoxia of the brain, problems with blood circulation in the brain before birth, birth trauma during labor and delivery, and complications in the perinatal period during childhood. Cerebral palsy can be idiopathic, in which the baby's brain does not develop properly while in the womb. Some cases, it can be associated with the mother's exposure to certain toxic substances. Brain damage can occur before birth, during birth, and within the first year of life.
Some risks of cerebral palsy include infection in a pregnant mother like rubella, exposure to toxic substances in a pregnant mother, infections in a baby after birth like meningitis, problems with blood circulation in the brain before birth, premature birth or low birth weights, babies in a feet-first breech position at the beginning of labor, difficult labor and delivery of multiple babies, severe jaundice in newborns, and head injuries after birth. Some signs and symptoms include stiff muscles, involuntary movement, muscular atrophy in affected extremities, lack of coordination, difficulty walking, an example of one foot or one leg may drag, difficulty with fine motor control, difficulty speaking, swallowing or eating, excessive drooling, seizures, cognitive impairment, weak or shrill cries, abnormal sensation or perception, and other health problems such as vision, hearing, and developmental delays.
During a well baby visit, the provider will evaluate muscle tone, posture, and reflexes, as well as look for any abnormalities in coordination. They will also make sure that the child has age-appropriate motor skills and sensory abilities like hearing, vision, and touch. Evaluating the physical development of the child is important, as well as performing screening tests to evaluate cognition. Some of the labs and radiology used to diagnose cerebral palsy are CTs and MRIs to see if there is any damage to the brain. Blood and urine tests may be used to identify some of the more common inborn errors of metabolism, and blood tests can be used to rule out other conditions like blood clotting disorders. So there are these lab and radiology resources available to help diagnose cerebral palsy. However, it is mainly diagnosed based on the history and physical exam. So as far as treatment goes for cerebral palsy, there is no treatment, but the provider can help the child and family create a treatment plan to help improve the symptoms and cope with the condition. Physical therapy is available, which will help the child with balance, flexibility, coordination, and strength through exercise and muscle training. A speech therapist can help with speaking or sign language, swallowing, and eating. An occupational therapist can be utilized to help cerebral palsy children take care of themselves. It can help improve the performance of daily activities at home or school. It can also help improve fine motor skills such as writing. Some providers may prescribe muscle relaxants to ease muscle stiffness. If the child has seizures, the provider may also suggest an anticonvulsive medication, and surgery may be recommended if the child's muscles or tendons are very stiff and limit the range of motion in the arms and legs. And next we have a YouTube video available to watch about pediatric cerebral palsy.
Contractures can develop and sometimes orthopedic surgery is needed, so we try and delay this by doing stretching and strengthening exercises, using splints and orthotics where necessary. In some instances, we inject the stiff muscles with botulinum toxin to relax them. Occasionally, more specialised treatments are indicated, but these are only in specialist centres. A number of children will go on to need orthopaedic surgery to lengthen the muscles. As they grow older and go into adult services, we look carefully at what's called the transition into adult services and try and look at what their needs might be as young adults, again, maintaining their independence as much as possible. Most young people with cerebral palsy are fully independent and have full active lives. So in describing cerebral palsy, I think it's important to be aware that it can range from very mild to really very severe. There's a lot we can do in helping improve the problems that occur with cerebral palsy. In the most severe cases, there is only a limited amount one can offer sometimes in terms of improving the mobility, but there is quite a lot we can do in terms of comfort, care of the child, and giving them the best quality of life possible.
For more information, visit www.nhs.uk.
Thank you for your attention to our Prezi. And this was presented to you by Olga, Bahar, and Ali, and here are our references.